Hi, this is Jessica DeMassa, and I'm here with Jamey Edwards, the CEO of Cloudbreak Health. Hi, Jamey, how are you?
I'm great. How are you, Jess?
Good, good. So, telehealth company here at HIMSS.
Yes.
Doesn't seem to be a lot of them around here. Why do you think that is?
You know, I felt like there were more telehealth companies around last year. I think the definition of telehealth is changing, so that's a piece of it. We as a company at Cloudbreak have evolved into a video collaboration platform that integrates not only the video aspect of telehealth, but also texting, messaging, and those types of things. I think when you look around HIMSS this year, though, you see a lot of AI. You see a lot of people who are doing EMR integrations and things like that. And it's been a really interesting perspective when you take a look at some of the tech leaders throughout the rest of the nation who are finally really coming to HIMSS with a presence. So you take a look at Google Cloud, Uber Health, Amazon, Apple doing their briefing. And while they're still learning healthcare, clearly a lot of those companies have had previous forays that haven't worked out so well. They're learning, and they're going to learn fast, and it's going to be really interesting to see how they evolve.
What do you think from a telehealth standpoint? I mean, like speaking, as a CEO of a telehealth company,
Yeah.
What are you hoping to learn from these big companies coming in? I mean, they've got a lot to learn about healthcare, but what about technology can you guys learn and bring in?
I think the hardest thing to do in telehealth is how do you scale your technology effectively, and they've clearly done that in spades, right? So how do you make sure that you can reliably deliver? We deliver 85,000 encounters a month right now, which is by far one of the leaders in telemedicine. They're delivering millions and millions and millions of different encounters over multiple modalities, and I think there's a lot of learnings there for us.
That's awesome. What else do you think you're seeing here at HIMSS? I mean, from your vantage point, which is, I think, unique. I mean, you have an entire telehealth meeting, right?
Yep.
But it's interesting to see these other technologies that you integrate in, and even in your own, with Cloudbreak, integrating in text messaging and integrating into EMRs and trying to work through that whole interoperability thing. What do you think other, people in telehealth can learn from a conference like HIMSS?
I think the fact of the matter is people need to stick to their core competencies. And as all of our platforms evolve to do more, we're going to want to find the companies who are the best at what they do, and then using APIs and SDKs and that type of functionality to integrate their processes into ours. We've met with various companies here, like Azalea Health, who does revenue cycle and EMR integration, about how we can integrate with them and they can integrate with us to come up with a combined platform that does it all, but where it's the best part of it all for each of the players involved.
That's so important, because I think a lot of companies try to build it themselves and to come up with an end-to-end solution. There's really no need to do that when you're surrounded by what you're surrounded by here. Yeah,
we realized very early on, take EMR integration as an example. There are companies who are going to do that 10 times better than we are. We're not going to go through that brute force field mapping exercise better than someone else, so why have a whole department do it? So we partnered with Redox, clearly the leader in the space for what they do, and so they do our EMR integrations for us.
No, that's fantastic. All right, so last question for you. We're asking everybody this.
Yes.
So we're asking everybody about their WTF Health moment. So WTF meaning, what's the future? So things are so bad.
Let me rethink my moment now.
Well, no, let's hear the WTF one, and then let's hear the what's the future one. So WTF one. Where have you been recently where you're just like, WTF Health, why? Why?
God, I haven't really walked the hall to the point where I've seen
I'm sure you'll find something.
Oh yeah, so last year, maybe 2 years ago at HIMSS, there was a vendor of hand lotion that was here. That was a little bit of a WTF moment when you walk around, you're like,
why are you at the health
why is there a health lotion manufacturer selling aloe vera lotion here at HIMSS? But they did it. In terms of the future, I still have a lot of questions around AI.
Okay, what do you mean?
Well, there's a lot of AI vendors here, and clearly the use cases are still evolving, and they're very cool. Yet if you look at its actual practical application, what's it really doing? Well, it's helping analyze big data and make sense of large data sets so that we can drive actionable insights from them. And that seems like level 1 of cognitive computing.
Right.
And I think we all envision, no, it's really supposed to be helping us diagnose and do all these different things. And it's not there yet, but it's on its way. And when I take a look at the proliferation of different AI companies that are here, I'm starting to see a lot more novel use cases. So an increase in the level of sophistication and creativity with which the technologies are being applied.
Jamey, thanks so much. It's always so great to hear from you. We appreciate getting that telehealth perspective, especially on a conference like HIMSS.
Yeah. No, the pleasure is mine. Thank you for having me.
Oh, thank you. I'm Jessica DeMassa with Jamey Edwards from Cloudbreak Health.